Good morning, everyone, and happy Social Work Month. My name is Annette Johns, and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador College of Social Workers. I will be your moderator for today's education event, Professional Self-Care and Ethical Imperative. And this is such a wonderful session to kick off Social Work Month. The presentation will be approximately 60 minutes, followed by a 30-minute question and answer period that I'll moderate. So during the presentation, we encourage you to type in your questions using the question mark icon widget to the left of your screen at any time, and we'll begin asking them at the end of the presentation. So you can just send those in as you're having questions throughout the presentation. The recording of this webinar will be available on demand and in the coming days on our college's website under our Continuing Education tab. I now want to introduce our speaker and my colleague, Simone Pelly. Simone is a registered social worker with the Newfoundland and Labrador College of Social Workers and chair of our Ethics Committee. For 20 years, Simone has worked with children, families, and adults in the field of mental health and wellness in New Brunswick and in Newfoundland and Labrador. Simone is a diplomat and certified member of the Academy of Cognitive Therapy, and this certification is awarded to mental health professionals who have demonstrated an advanced level of expertise in cognitive behavioral therapy. Simone provides cognitive behavioral therapy at our private practice in Gander, Newfoundland and Labrador. Simone, I'm really excited about this presentation this morning, and I'll now hand the virtual platform over to you.
Thank you for your introduction, Annette, and happy Social Work Month, everybody. Welcome to this presentation today. So, since about 2011, I've been working in private practice for various employee assistance programs, and this has led me to consider the concept of professional self-care. Now, this talk today is barely scratching the surface on the topic. But I hope that it will generate some productive conversation and that maybe others going forward might take on more detailed components of the discussion for further professional education. So let's do a few demographic polls now to survey those that are attending this session today. Okay, so I'm going to put this out to everybody. How many years have you been practicing social work? Less than 2 years, 2 to 5 years, 6 to 10 years, 11 to 15 years, or 20 plus years? All right, I can see some results coming in, and it looks to me right about now. I'm just going to give it a couple of more minutes and refresh the results. All right, so roughly we've got we've got about 10% today who are less than 2 years, right around 10% again, 2 to 5 years, another 10%, 6 to 10 years. And it looks to me that the bulk of those present today are anywhere between the 11 to 15 years and 20 plus years. All right, so here's another poll. What is your area of social work practice? Physical or mental health and addictions, private practice, child protection, community, long-term care, policy, education, or other? All right, I can see results coming in. Give it a little bit more time. More people, it looks like, joining our session now. All right. So here are the results. So definitely the bulk of the group that's here today are in physical health, mental health, and addictions. We've got some people in private practice, more in child protection, community, long-term care. So it looks like a distribution across all different sectors, with the most people in physical, mental health, and addictions. All right. So my hope for this discussion today is that I'm going to be able to offer a framework to examine your professional practice, identify your unique needs to enhance or improve professional effectiveness, and ultimately, my hope is that maybe you might be able to formulate an action plan to address needs to maintain a lasting and meaningful professional practice. So I remember back in high school, now I'm dating myself because that was like 30 years ago, in social studies classes, where we actually talked about the impacts of our largest generation moving through the workforce. And here we are today. Baby boomers have almost all but retired, and now we are beginning to encounter labor shortages. So employees who are left really have to compensate for those staff shortages. And this, of course, can give rise to workplace stress. So let's just review a couple of definitions that are provided around what workplace stress is. So the Canadian Mental Health Association proposes that stress is a reaction to a situation. It isn't about the actual situation. We usually feel stressed when we think that the demands of the situation are greater than our resources to deal with that situation. And the Canadian Centre for Occupational Health and Safety, they propose that workplace stress then is the harmful physical and emotional responses that can happen when there's a conflict between job demands on the employee and the amount of control an employee has over meeting these demands. The Canadian Centre for Occupational Health and Safety, on their website, they actually provide quite a comprehensive list of sources of workplace stress. So I tried to reflect a variety of those that maybe people attending this session today could relate to. So those things like workload is too much or quite possibly too little, supervisor conflict, role ambiguity, isolation, lack of promotional opportunities, lack of training, role conflict, job security, level of responsibility, unclear direction, multiple supervisors, poor communication. As you can see, there's roughly about 25 or 30 examples there of all kinds of sources that can give rise to workplace stress. Now, it's important to identify that my theoretical framework, my lens that I'm bringing to the discussion today, is that of cognitive behavior therapy. I'm going to reference a couple quotes in a book here that I've got handy. So Judith Beck in Cognitive Behavior Therapy, Basics and Beyond says, in a nutshell, the cognitive model proposes that dysfunctional thinking, which influences the patient's mood and behavior, is common to all psychological disturbances. When people learn to evaluate their thinking in a more realistic and adaptive way, they experience improvements in their emotional state and in their behavior. So just a few words to distinguish between what might be individualized care that I would provide in a session with any employee, with any person that might present with needs of workplace stress, and the general information that we'll be providing today. So treatment for the individual is based on a conceptualization. So that's a very unique understanding of individual patients, their specific beliefs and patterns of behavior. And the therapist seeks in a variety of ways to produce cognitive change, which is modification in the patient's thinking and belief system to bring about enduring emotional and behavioral change. So again, that's a quote directly from Judith Beck's Cognitive Behavior Therapy, Basics and Beyond, page 2. So today's talk is really going to be about providing general information on the formulated understanding of a person who would come in experiencing workplace stress, so that then you can self-assess your own situation and needs and formulate an action plan to address any outstanding needs to reduce or resolve workplace stress. So when a person comes to therapy for workplace stress, usually they present with a series of physical symptoms, also thoughts, behaviors, and emotions that are indicative, commonly shared and quite average for people who experience workplace stress. Often what I'll explain is that a person is actually having a very normal reaction to what one would consider to be an abnormal situation. So physical symptoms like muscle tension, headaches, digestive issues, high blood pressure, sleep disruption, heart palpitations, shortness of breath, where thoughts can become irrational, unrealistic, inflexible, extreme, simplistic. Person can have one-sided judgments, and maybe their threat perception might be a little distorted, therefore overestimating risk. Self-doubt can be really activated, where a person can underestimate their own self-competency and their own abilities. And thoughts can be self-centered, negativistic, catastrophic, and sometimes even hostile. Behaviors like the fight or flight or freeze can activate. So argumentative, aggressive, or avoidant. Examples of avoidance are incomplete documentation, decreased work attendance, arriving late, overworking, coming in really early, staying really late, falling behind due to excessive detail, and efforts to control situations or people. And that can then dissolve or lead into professional boundary violations. Common emotions that people report are feelings of anger, like irritation, annoyance, frustration, and rage, feelings of sadness, like discouragement, grief, futility, and hopelessness, and fearful feelings, like being worried, obsessed, insecure, and panic, and even feelings of disgust and guilt. No one signs up for workplace stress. In one form or another, this is one of the main automatic thoughts that someone speaks aloud in an individual session for workplace stress. And immediately, we're in the land of grief. You see, where there's a divide between our expectations of a situation and the reality of our situation, and a good number of years ago, it actually occurred to me, kind of had this thought, and it's right in line with a thought or an idea that's thousands of years old in Eastern traditions, that suffering lies in the land between our expectations and reality. So when someone comes in who wants to work on ameliorating workplace stress, we really do have to get right into problem solving mode and deal with the reality that's at hand. Now this, just a second, I'm going to grab my next literature resource to refer to. So this is a variation on the general cognitive model that I referred to in an earlier slide. This model comes from the book, Overcoming Your Workplace Stress, a CBT-based self-help guide by Martin R. Bamber. I got this book about 8 or 9 years ago, and its publishing date, if I remember correctly, is 2011. He proposes a transactional model of workplace stress. Well, his first quote that I'm going to read from in the preface, um, basically he says, unfortunately, of the literature that's focused on managing stress at work, much of it has consisted of rather simplistic explanations and overly standardized treatment interventions, which has largely ignored the conceptualization of stress as an interaction between the individual and their environment. So they fail to acknowledge employees as complex human beings with emotions and motivations who bring with them to the workplace their own history, past experiences, beliefs and attitudes, and idiosyncratic ways of coping and behaving. And then in chapter 2, he says, the transactional model of stress emphasized that stress is the result of an interaction between the individual and their environment. Stress is experienced when the individual appraises their coping resources to be insufficient to manage the demands of the situation that they are faced with. And so we're going to use this model today in the discussion, and we'll go through an example. So, as was said in that quote that I read, when we're looking at individual factors, and again, this is the uniqueness of any employee that is experiencing occupational or workplace stress, there's certain genetic characteristics, temperaments and personality, life experiences, early childhood experiences, level of education, training, skills, core beliefs, assumptions, culture, values, and of course the presence of any mental illness. And then we also have to take into consideration the interaction of those individual factors with environmental factors. And those environmental factors are demands of the position, physical conditions, coworker relationships, management styles, the existence or lack of supports, change, because often in employee and employer situations, there's often active and dynamic change, the role, and of course, striking a life-work balance. And then those interactions are appraised or evaluated through the lens of the person who's experiencing workplace stress, and they evaluate that they don't have the coping capacity or the coping resources to manage the workplace stress. And that's where this presentation today comes in. We're talking about an intervention to kind of target that area, or individual work would be done. So I do want to delineate the difference, as I see it, between personal self-care and then what I'm proposing now is as more of a professional self-care. Personal self-care, that's the behavioral and cognitive strategies one can perform on personal time to lower the effects of workplace stress. And I really appreciate there's a number of talks about personal self-care that have been presented over the years through the CASW or the NLCSW, that's the Newfoundland and Labrador College of Social Workers. And through the years, what I've been thinking about is kind of that absence of kind of moving into what are the behavioral and cognitive strategies that we can actually do at work through the course of our duties to lower the effects of workplace stress and to fortify ourselves against ethical drift and ethical violations. So, if we can imagine, it's almost like we've got a merging of two roads here. So the one road is being those behavioral and cognitive strategies that we can do to lower the effects of workplace stress. And then the other road merges in, and that's where we would use the same strategies, but they'd be grounded in our professional ethics and standards. And they would fortify us against something that we are going to refer to as ethical drift, or even against ethical violations. And those two roads merge into what we're going to formulate now and discuss as professional self-care. We'll delve a little bit further in the definition and the concept of ethical drift in upcoming slides. So behavioral strategies, it's just a clinically fancy word, really, to say what we do. And what we do to reduce the effects of workplace stress. Here's an outline, some steps of a plan that I would use with individuals to take a problem-solving approach to workplace stress. So I've got the little table there of all of the factors that we take into consideration that would be sources of workplace stress. And the first thing we would do is identify the problem. And once we've identified what the problem is, and it could be any of those factors that are listed there, right? So we kind of want to narrow it down. And often when I work with somebody, maybe we'll like look at a top 3 problems, and then we're going to start with the one where we can have the biggest impact for the person. Number 2, identify the factors that are within your control. And then, are there factors that are outside your control? Who's going to need to know about the plan? Because obviously, if we're looking at making some changes to practice, this might involve a discussion with a supervisor, with management, with the employer, right? I mean, these are things that might have to be negotiated and worked through depending on where we're going to go. And what supports can you engage to put the plan in action, right? So do you need to inform your team? Do you need supports from your team? Do you need supports from your employer? Or there are additional supports either through your professional regulatory body, or even an employee assistance program and individual consultation or therapy. And then, of course, with any good plan, we've got to be able to go back through and evaluate how things went, what was effective, and what might need to be changed. So, well, forgive me, there's a lot of words on this screen, I realize, but I just wanted to flesh out a little bit more what we're actually referring to in each of these boxes. So in identifying the problem, common problems would be time management, workload, staff resources, communication, conflict, timelines. Then we've got to identify the factors that are within control. So what is it that we need to stop doing? What's not working? What is it that we need to start doing? And from that, can we maybe formulate a series of some small goals? Are there factors that are outside your control? And if they are outside your control, are they something that's negotiable? So there I'm talking about employer standards of practice, codes of conduct, job description, duties, timelines, those kinds of things that are, implemented by the employer. Who needs to know about the plan? You need to communicate the plan and enforce new boundaries to maintain the plan. What supports can you engage to put the plan into action? Are you going to need boundary respect from coworkers, from other stakeholders? Do you need to communicate the plan and enforce those new boundaries to maintain the plan? And what supports can you engage to put the plan into action? Right? So that's that boundary respect, maybe creating a culture of respect amongst your team. Do you need to engage supervision and management support? And of course, employee assistance programs or any formal processes, right? Because some of the factors of workplace stress do require addressing a formal process. That might be conflict resolution, or it might be harassment policies. And then evaluate. Did the plan achieve what you set out to achieve? And if not, do we need to make any adjustments? So here's an example. Identifying the problem. This is a really common one that comes up a lot in the work that I do. Staff shortages. More work than what can be accomplished with the current staff numbers. And identify the factors that are within your control. So what do I have to stop doing? Well, often I've got to stop working as if there was a full complement of staff, which means an adjustment, a change process has to happen. And I've got to start by adjusting work practices to accommodate the actual demand. And that can be done in consultation with supervision and management, where adjustments quite possibly, if approved and through negotiations, where timelines can be adjusted or tasks might have to be changed where there is flexibility. I mean, obviously, in certain roles and positions, there are mandates that have to be accomplished, and there isn't necessarily flexibility on certain timelines. Who needs to know about the plan? Do coworkers and other agencies or departments, stakeholders, even clients, do they need to know about the changes to manage expectations? And supports, continual supervision, guidance, and evaluation with teams or with supervisors, EAP to manage stress, and of course, the ongoing evaluation as change is constant. So, change is not easy, okay? Um, it doesn't always run as smoothly as we hope it does. And there's certain cognitive roadblocks as our minds naturally resist change. We work using long-standing habits, and often we start to implement change, or often when we start to implement change, our own minds start to resist those changes. And self-doubt can creep in, self-doubt giving way to fear, and even self-critical thoughts that there must be something wrong with me if I can't keep up with the workload. So, as we're implementing a behavioral plan, and we kind of identified maybe some of those roadblock thoughts, that's where we have to implement cognitive strategies that can also help in reducing workplace stress and maybe clear out some of those cognitive roadblocks to put the plan in place. Because stress can change. It can distort how we evaluate ourselves. It can distort how we evaluate our situation. It can distort how we evaluate our own professional performance. Rational, balanced thinking can be hindered and distorted. Evaluations can reinforce and maintain feelings of stress. And we can engage in common cognitive distortions. These are like thinking errors. So some examples of these thinking errors are catastrophic thinking. Now that's an exaggerated negative prediction about the future in the absence of evidence. In the absence of any evidence that this would even happen. All or nothing thinking. I like to call this one the tyrant of the mind. That's dichotomous thinking, where shades of gray don't exist. And one thinks in terms of all bad or all good. Mind reading, that's kind of self-explanatory, right? So that's where one might think that they know what others are thinking. Magnification, it's exaggerating negative events or even negative personal traits, or the opposite, minimization, where one minimizes or discounts the positive, discounting positive events, or even discounting one's own accomplishments as they move through their plan. Personalization, seeing oneself as the cause, and the tyranny of the shoulds, the oughts. That's where setting rigid and unrealistic rules and standards about oneself or others or the work. So see if you can start paying attention to when you might hear some of these unhelpful thinking patterns, right, through the course of your work, through your course of your conversations, because automatic thoughts are spoken aloud. And that's how we collect them in individual work through the course of the assessment and kind of identifying the plan and the evaluation of the plan. So the cognitive strategies that we can use in challenging these unhelpful thinking patterns, they're listed there at the bottom of the slide. And I'll just do a little explanation. Examining the evidence. So what's the evidence for or against the thought you're having? Considering alternatives. Are there any other ways to look at this? We can generate alternative explanations and then examine the evidence for the new explanations. The double standard. I like this one because we're all social workers here and we all, well, very naturally have a high level of compassion. The trick is we often afford far more compassion to others than ourselves. So I like to ask, if a friend or a coworker came to you with this problem, what might you say? Estimating likelihoods, And that's where we might ask, what's the worst that could happen? What's the best that could happen? And, in evaluating those two extremes, really what most likely might happen. And then in putting the plan into action, we conduct a behavioral experiment because that's what a plan is, right? That's where we test out the thoughts and expectations that we have, and we go out into real life, put it into practice, and we bring it back, and we see what happens. So we put it all together in this basic cognitive model. And you can see how any of the listed distortions, those unhelpful thinking patterns about oneself, others, or the workplace, can affect a person. And therefore, someone can engage in unproductive behaviors to cope. All the while, this adds logs to the fire of coworker stress. So let's go back to that transactional model of workplace stress that we introduced a few slides back. And we'll walk through an example of what this might look like. Individual factors. So a person's temperament or personality. Somebody could be really high in conscientiousness, low in flexibility. And maybe their life experiences and early childhood experience were such that they had parents and an upbringing where there was really unrelenting standards, which led to an underlying prevailing core belief of feeling not good enough. And maybe couched in all that this person grew up in a culture that values outcomes and achievement. So when somebody who might fit that description encounters environmental factors like staffing shortages, increased workloads for remaining staff, the individual appraisal could be, I've got to work harder to get everything done as per the usual standard, and overworking happens. I should be able to do this. I can't keep up. I've failed. And so we'd start to use the cognitive strategies to challenge some of those beliefs and thoughts, and then begin to implement a behavioral plan, put that into action. So the point of intervention would be challenging the automatic thoughts that's driving the overworking behavior and generate behavior strategies, likely in negotiation with an employer, to adjust work practices to match the current demand of the workload. So remember, we have to make an adjustment between what the employee expects of themselves and the workplace and the current reality that they work in. So remember the two roads back a few slides. When working with professionals, and social workers are professionals, we also have to address our ethical imperatives and our standards in the context of workplace stress. So the CISW Code of Ethics outlines what professionalism is. Ethical behavior lies at the core of every profession. The Canadian Association of Social Workers, CASW Code of Ethics, sets forth values and principles to guide social workers' professional conduct. And that's why I use nautical theme in the slides today. Being here from Newfoundland, we've got lighthouses on our coasts, and we're very much aware of navigating the sea and avoiding the rocks. And that's what our Code of Ethics is for. It's a guide. And it can't guarantee our ethical behavior. Ethical behavior comes from a social worker's individual commitment to engage in ethical practice. Both the spirit and the letter of this Code of Ethics will guide social workers as they act in good faith and with a genuine desire to make sound judgments. So the quote here, both the spirit and the letter of this Code of Ethics will guide social workers as they act in good faith with genuine desire to make sound judgments. But workplace stress can distort one's evaluations and our professional judgment. So I'm a part of the NLCSW Ethics Committee. And as part of that role, the committee, we generated ideas for a publication called Ethical Compass. Now, later on in the presentation, I'm going to take you for a tour around our website and just look at some of the professional resources that are available to us as social workers to help guide us through some of these things. But the Ethical Compass is an initiative of the NLCSW Ethics Committee, and it's intended as a resource for members. So the issues covered in this publication have been identified by social workers as part of the NLCSW ethical consultation process and from a review of ethical trends in practice. And there we address this concept of ethical drift. So ethical drift is an erosion of ethical behavior, and it might go unnoticed by the professional and justified as acceptable. All the while, the professional believes that the ethical standard is being maintained. So in this illustration, we can kind of walk through the steps down that could lead us to ethical drift and quite possibly even practice violations, right? So a very normal situation that social workers encounter involves workplace stress. That, of course, gives rise to distress, which can distort our thinking. And in that, we use coping strategies to reduce our distress. However, it could be ineffective behavior that could have negative consequences and implications for our professional practice. That's what we're calling ethical drift. And if going unchecked, it can even move into and drift into ethical standards practice violations. Okay, so I'm just going to run through what this kind of looks like, right? So an individual, a professional social worker, can be in a not uncommon situation of workplace stress and experience a certain level of distress. And maybe this distress is anxiety. And with anxiety, there's a certain cognitive model that we as cognitive therapists look at, and it's generally catastrophic thinking. Or a person who's experiencing the anxiety, they might overestimate risk, they might underestimate their ability to cope as a professional, or maybe even their client's capacity to cope with the challenges, right? And the thinking becomes, what if the worst happens? And then, in order to mitigate that distress, quite unawareingly, one's risk tolerance might be lowered. And then a social worker might engage in paternalism and end up doing for a client what the client could have done all along for themselves. So let's go to a poll question. How often do you refer to the CSW Code of Ethics and other practice resources and documents? So I refer to these resources at least weekly, monthly, annually, or I don't refer to these resources. And the results are coming in. Give a few more seconds to give people an opportunity to contribute, offer their feedback today. Okay, so I'll send those results now to everybody to have a look at them. So we've got roughly 5% of people, 4.5% refer to them weekly, and the bulk in there refers to the resources at least monthly. And we've got over 60% who refer to them at least annually. All right, so as you can see, as distress gives rise to distorted thinking, unhelpful thinking patterns, professionals can move away from the ethical groundings of our code of ethics and our guidelines for ethical practice. But we can actually use the very cognitive strategy of examining the evidence and make use of the tools provided to us through our regulatory bodies. And in the Ethical Compass, in that practice document that was produced by the Ethics Committee, actually just back in September, actually, of 2022, there we can turn to the Code of Ethics for guidance, our guidelines for ethical practice, our NLCSW as a publication, the importance of knowing your code of ethics and standards of practice. And I want to just highlight actually another tool that's available on the NLCSW website, and that's the Ethical Decision Making in Social Work Practice. Now, that document was produced covering basically an introduction into ethical decision making, talking of components of ethical practice, addressing issues of risk tolerance, and that was something that I had identified in that example that we had done. And basically what it is it's a model that promotes critical thinking and reflection. So it's a series of questions that a social worker can walk themselves through when trying to make a determination, right, as to whether or not maybe they could be drifting off course in their services to clients, working in a high pressure environment. And so such questions are, what's the ethical dilemma? What's my immediate reaction or instinct? What theoretical lens am I considering the dilemma? Consulting the Code of Ethics and Guideline for Ethical Practice. Consulting the NLCSW standards of practice. What standards might apply to the dilemma? When we consult the code, of course, we're going to be looking at and see if, of the values of the Code of Ethics, might there be a conflict? Of course, we've got to consult applicable agency policies and what direction is the employer giving? Are there legal considerations? Might we need a relevant a legal consult, or is there relevant legislation that might address the issue? Was this issue addressed through informed consent? What are some of the available options or choices for resolving the dilemma? Consultation with a peer or manager, considering the context of practice, discuss the dilemma even with a client where appropriate, consider the impact on therapeutic relationship, what other resources might be available to help in decision making. Of course, we'll need to document the ethical decision making process. And I will point out when we go through the website that there's a lot of information in terms of the NLCSW standards pertaining to documentation and recording there. And with any line of thinking, we've got to monitor and evaluate the impact of the decision and modify if necessary. And so in that ethical compass, we also talk about the usefulness of consultation, the review of the practice resources, documentation, maintaining professional boundaries, and of course, continuing to engage in self-reflection. So here's another way of thinking about the two roads that we talked about earlier in the slide, in the presentation. So we can think in terms of our work that some things, they're possible negotiables as an employee. And of course, when I say possible, that's within the confines of, an employer's practice standards and, mandates. But we can think of it in terms of the who, the what, the when, and the how. So possible negotiables might be roles and responsibilities, how we prioritize our work, deadlines and timelines, and procedures and processes. But we also have things as professionals that are our ethical imperatives. And those things, they're just non-negotiables. And they must be maintained regardless of workplace conditions, like confidentiality, informed consent, client autonomy, scope of practice, conflict of interest, and boundaries. Okay, so now I'm going to try to share my screen with all of you today, just to go into the NLCSW website and explore some of the wonderful resources that we have there that are accessible to anyone across the country who might be looking for some support in these areas. Now, I'm hopeful that the screen did share, and Annette, certainly feel free to speak up if we're having any technical issues there that I can address. So if you can look along the top there, and my little pointer, when we go down into practice resources, there you can find our code of ethics and standards, information about our ethical consultation process, the ethical compass, which is what I had talked about and referred to. So our most recent one that we published was Social Justice in the Public Domain back in 2022. Here is the ethical compass that I was referring to there, that goes into good detail about how to prevent ethical drift in social work practice. And I think the ethical compass now has been in operation for about 6 years. So as you can see, there's a number of topics there that we address: the ethics of boundaries in social work, virtual care, key considerations, the ethics of disclosing client information, cultural competence in social work, collegial conflict and social media challenges, being your best professional self, ethical decision-making and documentation, dual relationships. So yeah, there's just, I think I counted 18 ethical compasses there. We'll go back into practice resources again. We've got various practice documents that you can revert to there. And that's where you'll find the ethical decision-making model that I'd read out those steps. And again, we've got practice matters. Now, practice matters are a little bit longer. They're a little bit more in depth than our ethical compasses. And that's where we also address all kinds of practice issues that one might encounter through the course of your work. And the ethics committee, we actually broke up into subcommittees over the last number of years, and one has been doing the ethical compass, and the other group has been doing documentation matters. And this is actually quite extensive. There's 14 tips here, all around documentation and things to consider when doing your documentation for clients. I mean, documentation is essential, right? It's how we track a person's progress. It's how we communicate what it is that we're working together on, how we formulate goals, and how we evaluate outcomes. There's also forensic reasons for documentation for those that might be needing to keep notes for legal purposes. And it's a way to keep track of information for our clients. And of course, it's an ethical imperative. So we also have our Connecting Voices, which is a regular journal that we publish twice a year, and we feature in that we do an ethics article, and we feature in that all kinds of information about social workers all across the province, the good work they're doing, new programs, interesting topics, book reviews, and certainly we invite any registered social worker to contribute there. And so all the information is on that for what anyone would need to know if they want to contribute. And I also sit on that editorial committee as well for the Connecting Voices. Okay, so that's a little bit of a tour that we have through our professional resource. I'm going to stop sharing. And I'm going to come back through now. So finally, it would really be remiss for me not to talk about when employees or what employees must do if there aren't any negotiables. Okay. So if there aren't any negotiables and a person is not able ultimately to lower workplace stress despite their efforts, sometimes we come to necessary endings. And when I work with employees, we actually, throughout this process, I like to call it creating an escape hatch. And we use several behavioral strategies there to do this. So we keep an eye out for goal-focused continual professional development. Keep your CV updated. Regularly check job boards. Apply to open positions. Even attend interviews to maintain your interviewing skills. And if you are offered for a job, apply for a leave of absence. I want to go right back to the workforce and talk about that there really has been a change in the kind of the balance of powers, and employers are becoming very accommodating to employees. And I would say that now is probably a climate where leave of absences are being granted. And really, at the end of the day, what we want to do is put yourself in a position where you're actually, if you're offered a job, choose to stay. And that is a completely all different alternative standpoint than ever feeling like you're stuck. So this takes us to the end of today's talk. I hope this was a productive and meaningful time for all of you who attended. My hope really is that this is going to be a conversation starter about professional care. And as we face the ever-growing challenges of the dynamics of the changing workforce, I would really like to see this promote additional discussion in any or all of the topics and additional topics that were addressed throughout this presentation. So let's move on now to taking some questions.
Wonderful. Thank you so much, Simone, for this excellent and informative presentation. I can't believe that hour went by so quickly. I was just listening to everything you had to say. So thank you so much for that. So we do have lots of time for questions, and we do have some coming in. So I encourage everyone to submit any questions that they have over the next little while. So I guess to begin, Simone, someone is wondering if you can give an example of ethical drift.
Yeah, so again, let me go back now because I want to make sure that I'm quoting from our publication, right? So ethical drift refers to an erosion of ethical behavior, and it can go unnoticed by the professional and justified as acceptable. So the example that I had previously used, right, is in an environment where there is workplace stress, stress, right, can give rise to a person's evaluation of themselves or their situation, and it can become distorted. And the example I had used was risk tolerance, right? So often in the course of our work, we kind of oscillate between, well, actually, I mean, in the code of ethics, our first value right at the beginning. Value number 1 respect for the inherent dignity and worth of persons, right? So we are in our principles supposed to uphold each person's right for self-determination, consistent with that person's capacity and with the rights of others. So, I mean, social workers do have a role to have ongoing assessment when working with people and taking into consideration a person's capacity. And therefore, we got to be pretty grounded in our ability to be able to do risk assessment and capacity assessment. And in a place where there might be workplace stress and a person might be feeling anxiety, it could distort their risk tolerance. So they might overestimate risk where there is some, but there might be an overestimation of it. And there could be an underestimating of the client's coping capacity and their ability to be able to deal with it. And that can give rise then to feelings of wanting to exercise unnecessary control of the situation, right? And we would call that paternalism. And therefore, we might end up overreaching and doing more for clients than what they can do themselves, right? Advocating for themselves or making phone calls for themselves or looking and seeking out services or resolving conflicts, all kinds of things, right? So the lower in risk tolerance can give rise then to kind of an activation of paternalism and thus can drift off into exercising control where there really shouldn't be.
Okay, excellent, thank you. This is a question, a two-pronged question, I guess. Part A, why are professional boundaries so important in professional self-care? And then the second part, from someone is wondering about any advice or feedback for setting boundaries with coworkers who may have become your friends from work.
Those are excellent questions. And Annette, I can't, I'm not going to screen share, but didn't we address that in an ethical compass a while back specifically?
Yes,
We did. Do you remember the title, or can you go back and maybe get it while I kind of talk about this question? This is why I really love the practice resources, right? Because I can point to this as a tool for somebody to kind of step back now after and read through it and think about how they might be able to address it in their practice. So, okay, so I'll go into the first part of the question while Annette's doing that. And why are boundaries, professional boundaries and personal boundaries important? So the way that I define boundaries, actually, Anne Catherine's book pretty much summarizes it here. Boundaries are basically, it's a demarcation of where I end and where someone else begins, okay? And they provide us with structure and limits. And quite frankly, there are freedom and limits once we've kind of carved out what the rules of the game or the outline of our interaction might be. So I think of boundaries in a couple of ways, right? So there's physical boundaries, and physical boundaries could be like our office space. And it actually makes me think of the 1980s comedy show WKRP in Cincinnati. Now, again, I'm dating myself. High school 30 years ago in WKRP. But in that, Les Nessman, one of the reporters, they have an open work environment. And there's a lot of literature, for and against open work environments. But there at the radio station, there's an open work environment. And Les gets really frustrated about the intrusion on his physical boundaries. So he takes some tape to mark out around his desk where he wants people to kind of stay back. But in a closed working environment or an office space working environment, right, our office door is a demarcation of a physical boundary. And that might be something that we need to do to send a message to our coworkers that I'm working on something really important and it requires my concentration for a time. Outside of physical boundaries, I also think of like privacy boundaries. And privacy boundaries, we can talk about that in terms of ourselves as employees, how much information we might want to share with our coworkers about ourselves, our personal information, how much information we might share with a supervisor or management, like our bosses. And of course, that might vary with any level of information that we might share with human resources, right? HR. In the context of clients, we think of the ethics of self-disclosure, right? And we also have an ethical compass that addresses that. Of course, confidentiality is a privacy boundary, and our limits of confidentiality, and when sometimes we need to step outside of confidentiality for the safety and security of clients and the public. How and what we document in the storage of our records. I think about that a lot, right, in private practice, because I am a custodian of people's health records, and how they're stored, when they're destroyed, and then how I would communicate that with clients, the process of ongoing informed consent. Then time boundaries, right? So how much time do we allot to work tasks? How much time do we allot to assisting our coworkers? How much time do we allot in our workday, whether we do overtime, whether or not we can refuse overtime, whether or not overtime is mandatory. And of course, a lot of social workers do a certain amount of on-call. So with our clients, also through the informed consent process, we might go over how much time we allot for visits or sessions and phone calls. When we're going to return a phone call, what kind of timeline they can expect to manage expectations or emails, and whether or not we have time in between those scheduled times to be able to do emergency interventions, what emergency interventions might be available to them if we don't have time to do that kind of stuff. And just making people aware of, all of the ways that we do have to divvy up our time. So Annette, did you get the name of that one, that ethical compass, where we did that?
I did, and we produced that one in November of 2019, and it was very specific to that topic. The title was "Can You Help Me? The Ethics of Giving Professional Advice to a Friend, Neighbor, or Colleague." So we broadened it out to friend, neighbor, or colleague in that resource. So that again is available on the NLCSW website under Practice Resources Ethical Compass. So lots of topics that we've covered over the
Awesome.
years. Ethical Compass, yeah.
Yep. And I've got a couple of resources actually I can share here. One is Boundary Issues and Dual Relationships in the Human Services. That's by Frederick Reamer, professor of social work. And I think he oversees an article, I think, ION Ethics, does he not? Yeah, talking about various issues around ethics. So that's a really thorough book for professional boundaries. And another resource that was just recently published, 2021, the Set Boundaries Workbook, Practical Exercises for Understanding Your Needs and Setting Healthy Limits. That's by Nedra Glover Tawwab. And I think that's my best pronunciation of her name. She's also a New York Times bestseller, author of Set Boundaries and Finds Peace. I've gone through this actually myself, and I recommend it to anybody to use for yourself and also to use with clients. I've gotten a lot of positive feedback on this particular workbook for helping people understand kind of where they are in terms of boundary settings and what their needs are and what they can do to improve that. So, next question.
Yes, thank you so much. Yes. This is a comment that will lead into a question. It's from a upcoming social work graduate who was completing a project on their final placement, and the topic was burnout in practice. So the person just wanted to say how informative this session was, both for their future career and for their work. So I guess in terms of an opportunity maybe to distinguish between some of those terms, Simone, around burnout, compassion fatigue, and workplace stress, and what the differences may be.
Sure. Yeah. So when I think of burnout, I kind of think of it like, if we can kind of look at from a workplace stress perspective, it's kind of like at the end of a continuum, and quite frankly, the biggest antidote to burnout probably is a job change. And we talked about that in terms of like necessary endings and what step a person can take, and then working through with a person on the grief process, right, and loss of their dream or their idea in a particular area. But the thing I love about the profession of social work is, as we surveyed at the beginning of this talk, there are plenty of job opportunities in sectors where a person can still very much practice social work and be able to, really be who they are and have meaningful work, moving on from a place that might have, unfortunately, led to burnout. Now, some other terms that we kind of reference, compassion fatigue is another one, and there's been a number of talks and presentations on the CASW website on compassion fatigue. Now, I didn't even touch on compassion fatigue, okay, because, but social workers are at risk of compassion fatigue, not just workplace stress, but also compassion fatigue. Now, compassion fatigue in its definition really talks, it's referring to people who work in the areas of the helping profession and working with people who have been traumatized, people who have complex needs, and even with a full complement of staff, right? Even with adequate resources and support, compassion fatigue can occur, right? Even with an equal distribution of workload. And so the symptoms of compassion fatigue very much mirror the symptoms of workplace stress, but the impact on the social worker would be basically that their capacity to be able to experience compassion and engage in meaningful work with the client might be diminished. So social workers are at risk for workplace stress, burnout, compassion fatigue, moral distress, moral injury. And that's really why the necessity of personal self-care and professional self-care is vital for us.
Oh, thank you. Just quickly, someone's just asking if we can repeat the names of those two books that you referenced, Simone.
Oh, of course. Yeah. So it's the Set Boundaries Workbook, Practical Exercises for Understanding Your Needs and Setting Healthy Limits. This was actually, believe it or not, on one of the front tables walking into Indigo chapters one day when I went in, right there front and center, and it caught my eye. So it's quite readily available. And then the other one is, this was for more professional practice, Boundary Issues and Dual Relationships in the Human Services. And that's by Frederick G. Reamer. And you can also Google his name and look up Eye on Ethics and get all kinds of online articles there discussing many of the things that we talked about today.
Excellent, thank you. And others were wondering about the PowerPoint. So just a note that the PDF of the PowerPoint is available in the resource section on the webinar platform for those of you who are asking about that. So moving into another question, getting back to the CBT model, Simone, someone's wondering about, understanding how the CBT model can work when stress is very high or chronic, and looking at the impacts on the nervous system and behavior can be so profound. So how do we account for that in terms of understanding the neuroscience and at that, if they're not able to assess the rational cognitive functions that we have when we're in that flight, fight, and freeze?
Yeah, right. So I mean, really what you're talking about there is stabilization. Right. So when you're doing individual work, when I'm doing individual work with somebody, depending on the place where a person's at, right? Because, you're right to point out when distress is high, as I say with the kids that I work with, right? When distress is high, thinking goes out the window. and that can happen. I mean, and a person can come to a session really activated. And so that actually is a time when stabilization actually needs to occur, right? So, we're not really going to like delve into the cognitive model and kind of do the psychoeducation about all that. We've got to set that aside. And really, it requires, us using our more crisis intervention skills to assess where the client is at, and maybe help them with some skill building around bringing down some of those really strong symptoms that are occurring, and giving them a safe place to be able to just begin to decompress, and then looking at kind of a plan. Sometimes that plan might involve stepping away from work and taking some time off. Sometimes that plan might be going to see a family doctor, and also getting a thorough physical health assessment and physical workup, and a mental health assessment there by the family doctor. And usually, in that situation, we're really looking at a time of rest and pause until some of those really acute symptoms can start to settle, and then we would move into targeting some of the the cognitive presentations and behavioral strategies that we'd have to do. So first, stabilization, crisis intervention skills, good thorough physical health workup, a pause, a time for rest, and stepping back.
Okay, perfect. Thank you. Still lots of questions coming in, so we'll try to get through as many as we can, but still keep them coming in. This question is more related to when there's more inflexibility in the workplace. So how do you make behavior adjustments if the employer or supervisor is unable to support any behavior adjustments? So how do you kind of manage that?
Well, that really comes down to, again, evaluating your domain of control, right? And so if there isn't any flexibility in terms of policy and procedures and timelines and mandates, and, being realistic, that can happen in particular service areas, then we got to take a step back, and we just got to kind of narrow it down as that little tiny scope of where a person has an ability to be able to control or make adjustments to maybe their work style, right? So we're talking about work style then. So we're talking about looking at how you might conduct a session, when you might document those sessions. Are you like a person who's ready to go in the morning, and therefore you might see people then, or in the afternoon if there's flexibility there? When might you record your interventions, how you might do it? Maybe there might be, practical adjustments and those kinds of things. But it really is about taking it down to its lowest common denominator, being very realistic, and just seeing what you do have control over. I'm going to use myself as an example, because I've been doing social work now 23 years, and I've been in all kinds of different sectors. And in one particular sector I worked in, there was a lot of change. And it seemed that whenever we got a new director, there'd be a new idea and a new implementation of a plan. And we get change tired, we get change exhausted. So usually after that kind of a meeting, or if a new policy was rolled out, I literally had a Word document that was divided into 2 columns: things I can control, things I can't control, and strategies I can do to make a change. And sometimes that meant just shaving off little techniques and areas in little places where I can affect a cumulative change. That actually just occurred to me. I don't know how many of you might be familiar with the latest pop culture book called Atomic Habits. Author of Atomic Habits, I just got an email, I think, today, James Clear. That actually talks exactly that concept, where you're looking at making, and he uses the term atomic because it could be a little thing like an atom and affect a big change. And where you would look at your daily habits and little things that you might be able to do to change that would accumulate into bigger changes. So yeah, that would be my suggestion in a situation such as that. And of course, as I had said before, sometimes there is a necessary ending. And if there isn't the flexibility that a person might need to balance that work life balance and to maintain good mental health and effective practice, yeah, sometimes it might mean looking somewhere else and developing a professional development plan to pursue in another area.
Okay, excellent. Thank you. So someone's saying thank you for the cognitive conceptualization of workplace stress. Do you have any, or could you offer some possible ideas of factors that may be part of an employee's experience when they are avoidant of work? For example, not meeting minimum expectations for the number of appointments per day, while also, complaining or feeling of being overworked and overstressed.
Yeah, so avoidance is like it's a totally normal coping strategy to deal with stress, right? Um, because when you have to face the thing that causes the stress face on, you incur additional distress. So avoidance is a very average, normal reaction to abnormal circumstances. And so I guess that depends on, I'm going to use a social work term I haven't used in years, positionality, right? So that's like where you sit. So for me in private practice, when I'm working with an individual and a professional who might self-recognize they're avoiding, right? So already they're seeing that they're doing it. Then we might look at ways that we can reactivate or start doing what's been stopped. And usually, right, when you start doing what's been stopped, just like when I work with somebody who is avoidant with an anxiety disorder, we're going to do basically a hierarchical exposure plan where the person will self-identify in a hierarchy the most attainable goals and things that they would like to change all the way up to the most challenging ones. And we would kind of insert things that the person can do to temporarily cope with any anxiety that is going to activate that they would normally use the coping of avoidance. Okay, so that's in the context of me as a service provider with somebody who might be using avoidance, who already has come to the point where they recognize it. But positionality. Well, what if you're a social work supervisor working with an employee who might not necessarily be aware that this is happening? So, that would be through the course of your supervision, and just like, any supervision model that the problem would have to be identified. And then support. Usually the questions asked is how can we support you in order to get you going to do these things? And that would be negotiated. Certainly if there's any, self-disclosure of stress and distress and that talking about feeling overwhelmed and kind of talking kind of the narrative that happens in a place of workplace stress where people they talk a lot about how much work there is to do. And sometimes we need to kind of move into how we're going to do the work, right? And there as well, professional EAP services can be offered, those enhanced services to help a person move through some of those roadblocks of avoidance.
Excellent, thank you. The last book that you referenced, Simone, so I was just wondering if you could repeat the author's name of that book again.
Is that the Set Boundaries workbook or the Frederick Reamer book?
No, the last book that you spoke about, not the boundaries.
Oh yes, that's Atomic Habits.
Atomic
Yeah,
Habits.
yeah. So that's Atomic Habits. That's James Clear.
James Clear.
Yeah,
Okay.
Atomic Habits by James Clear, and that's a pretty popular book. You might probably find that right front and center in most bookstores as well. And it's actually quite useful. I've listened to the audiobook myself, driving around rural Newfoundland, and it's been really helpful.
Excellent, thank you. Someone's asking if the recording of this presentation will be available, and yes, it will be. So if you go onto the CISW website and click on the workshop, you can view the on-demand version. And also the recording will be on the NLCSW website as well under our continuing education. So our next question is, and this might be one of our last questions, but if you do have any more, keep them, coming in. Would you be able to run through another example of applying the CBT problem-solving process? Will be helpful, around, if there's an example like cultivating flexibility, for example. Anything you can share there from another example?
You see, okay, now I got to think on my feet. So I'm gonna just go through all my paper notes and find that slide. Again, I am dating myself because I'm going through paper notes rather than flicking back. Well, oh no, maybe I should just flick back, right? That would make the most sense. So I'm gonna just go back to the slides that I was using. It was one of those really wordy ones. Yeah, so there's like a lot there. Okay, so I've got to push to audience. Yeah, so that example, cultivating flexibility. Right. So, I mean, again, I keep going back to like the current workplace environment right now where we do have less staff. It seems to be across many sectors. And with the exiting of one generation, and then just the smaller generations that are kind of coming up. So the example that I had given was staff shortages. Geez, thinking on my feet of a specific example. Annette, do you have one that maybe I could give me a hand with another example that I might be able to walk that through?
Or maybe we can just table that one, and we can come back if we have some time to give yourself, not to put you on the spot, right? If to
Yeah.
another example before we finish. But maybe if we looked at,
Yeah, let's do that. Yeah.
let's do that. So you talked about in your presentation the culture of respect. Can you clarify what's meant by culture of respect?
Yes. So that that was another thing for, by way of self-disclosure that I really had the opportunity to do a number of many years ago in my early social work practice, where we did have a very glaring situation of staff shortages for a period of time in a particular program, and quite an increase in workload. And as a team, we decided that we would take steps basically to identify each of our own needs in terms of how we did our work styles, and what it was that others in the group could do to support us. So it's not that anybody was going to pick up anyone else's work. It was more about things like, I'm going to take some time each day to do paperwork, and I'm going to close the door, and I'll just put a little notice up that I'm not available from this time. And then team members would respect that. And then even the supervisor wouldn't interrupt until that time was done. And we discussed kind of like what would be the priorities that would warrant an interruption, right? We also talked about as a team, we had to do like duty and coverage. So we looked at like who worked best outside the office doing home visits at what time of day, when things could be scheduled, because obviously in emergency response, that's not the case, but when things could be scheduled and planned, and who worked best outside the office, like in the morning and in the afternoon, and who would do the coverage, and when would other people do paperwork. So basically we kind of looked at, rather than how much work we had to do, because it was there, had to be done, we talked about how we were going to do it, identifying each other's work styles, needs, and how the other person could respect and support in reinforcing those boundaries.
Mm. Excellent. Okay. So as a takeaway, I guess, what are some of the things that you would, in a summary, say to take away the top three things to promote, professional self-care?
Well, I think I think anybody could do this exercise today, really, because I know there's people, all over the province and quite possibly around the country. Um, if you take a minute at some point in the day to kind of rate your own workplace stress, your own stress levels for the day, right? So 0 being no stress, 10 being the most stressed. Where do you sit? And maybe it might even be useful to kind of monitor that during certain times of the day, during certain kind of activities, and see if there's any trends. And is it affecting your ability to effectively do your work, right? So then you want to identify the source. So I guess, well, hey, this is kind of an example, right? An in vivo example of that question that we put on pause, right? So you're going to determine, the who, right? Your role and your responsibility, when, deadlines, timelines, are priorities a problem? That's kind of the what, and what you could do, right? What is within your domain of control to either be able to build new habits or consult, right? Seeking supports, consultation through, your boss and the next level. I mean, all of us here, regardless of where we sit, kind of in a chain of command in any agency, generally we answer to somebody, and generally we have somebody that we can go to guidance, right? A trusted peer, or a professional consultation group, or even our regulatory body. And then to kind of step back and then to look at, like, are there any ethical standards of practices, issues that might need to be addressed? And then you can go to the NLCSW website and there access any of the practice resources. And I really strongly recommend that you all just go in and print off that ethical decision making model, because there's that process is really clearly outlined. It can be used to anchor you in times when thinking can go out the window sometimes, and it's good to get grounded. Just like our compass that we use as the image to kind of point us back again to our true north.
Excellent. Thank you so much, Simone. And I think that brings us to the end of our questions. So thank you, everyone, for posing those questions. It was a great discussion. And thank you, Simone, for being so open and willing to engage in that discussion period. It just certainly helps add to and flush out, some of the material that was discussed. So thank you so much. And I don't know if you had any concluding thoughts outside of that you wanted to share before we formally wrap up for today, to give you a last minute.
No, just want to thank everybody for attending, and I really appreciated the questions and the discussion that was had. And if anything, my wish is that you just all take this back to wherever you are, to consider it, to put some of these things in practice, and to bring it back and share it in this kind of a venue for the rest of us again in the future.
Yes, yeah, and I want to echo what some of the comments were coming in, how wonderful the presentation was, Simone. We had some comments coming in and how they're going to use that in their team discussions. So that's wonderful that will happen. But I want to take this opportunity to thank you once again, Simone, for facilitating this excellent webinar for us today and for sharing your experience, expertise, and knowledge. And so much information was shared. And you noted at the beginning that you were scratching the surface, but this is material that we can take away and reflect on in our own journey of professional self-care, because it truly is, this type of knowledge exchange, reflection, discussion that we can enhance our skills in providing the best quality services that we can, while being our best professional selves. So that was very important. And just want to note, Simone, that your words are always so inspiring. And I've said that to you many times, and always grounded in the code of ethics and our ethical and professional responsibilities. So I want to thank you for taking time from your busy schedule as a private practitioner and joining us in this session today. It's truly appreciated. Just a note, some housekeeping. RSWs in Newfoundland Labrador may claim 1.5 required credits for attending this webinar as per our CPE policy. For those joining from across the country, check with your regulatory body on how you can claim this session and download the certificate of attendance that will appear if that's required. And as I noted previously, the PDF of the PowerPoint presentation is available in the handout section, resource section on the platform, and the session has been recorded. And as you begin to sign off, we also ask that you complete the evaluation form that will appear on your screen. Certainly, participant feedback is always so greatly appreciated. And on that note, thanks again, everyone, for joining, and enjoy the rest of your day and all the Social Work Month events and activities. And again, thank you immensely, Simone, for joining us in this kickoff session for Social Work Month.